Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 Homeopathic Remedies for Menorrhagia or Excessive Mense. What is menorrhagia? Menorrhagia means excessive menstrual bleeding either in terms of time, more than 7 days, or in terms of amount of blood, needing change of pad in less than 2 hours or passing clots equal or more than 1 inch in diameter in one cycle. The definition has been represented from various angles, and it is really much deserving definition. What are the causes of menorrhagia? Causes may be of 3 types. Hormone related, that is imbalance between estrogen progesterone, uterus related, uterine fibroid, polyps, uterine cancer, cervical cancer, use of IUD, that is intrauterine devices, miscarriage and rupture of ectopic pregnancy, so on and so forth. Others bleeding related, that is platelet function disorder or non-bleeding related disorder like pelvic inflammatory disease, thyroid disease, etc. What are signs, symptoms of menorrhagia? Menstrual period lasting for 7 days or longer. Menstrual flow needing 1 or more pads every hour for several consecutive hours a day. Need to change pad even in nightly hours. Heavy flow that bars one from doing her normal duties. Menstrual blood contain clot with diameter 1 inch or more. Constant pain in lower abdomen. Extremely tired and short breathing. When to consult a doctor in case of menorrhagia? Menorrhagia is a serious ailment that can endanger their quality of life, both present and past. One should contact doctor as soon as possible when it looks like menorrhagia. It causes severe anemia leading to so many other troubles. So that's why it needs extra attention. What is the treatment of menorrhagia? Menorrhagia is fully treatable and curable in homeopathy. There are a lot of remedies in homeopathy, numbering more than 80 in the famous Homeopathic Therapeutics by Dr. Samuel Lilienthal, covering pictures of all types of women in society, from which I have chosen only 10, top 10, with their indications and selection. Many suffering viewers may not find their match in these. Nevertheless, the match is there amongst the remaining remedies. There are so many remedies. I have mentioned only 10. Your physician might find it out after recording your case. On the right hand side, I have given a picture of respected Dr. Samuel Lilienthal. General management of menorrhagia. General management is not without medicine. What is general approach? Take foods rich in iron like beans, spinach, tofu, chicken, turkey, etc. Take foods rich in vitamin C like citrus fruit, broccoli, Brussels, spinach, kale, etc. Use cast iron pot for cooking. Cast iron pot, it gives, it is presumed that it gives some benefit of iron in the food. Use reusable silicone menstrual cup for holding more amount of blood. The picture is given at the end, right hand side. Wear period panties to avoid leaks. Third picture. Apply heating pad to reduce cramp. Take blackstrap molasses, a good source of iron, calcium, magnesium, selenium. Actually, blackstrap molasses are generally used by persons of rather poor families, but it is a very good source of iron, calcium, magnesium, selenium. Very good source, rich source. Now we are taking remedies. Arnica mont for menorrhagia. Menorrhagia with pain in small of back, extending into groin, down the inner side of legs up to the toe. After a blow or fall or riding over rough roads, blood bright red or mixed with clots, heat about head, extremities cold. The smaller back, I have given the picture here. This is called smaller back. This is lumbar region. Lumbar region is black of back, smaller back. Rustox for menorrhagia. Menorrhagia from strain in rheumatic women. Worse at night, changing positions constantly for relief, and worse at every change of weather. Sulfur for menorrhagia. Chronic ailment seems to get well when it returns again and again, day after day for weeks. Fainting spell with flashes of heat. Heat on the top of head, cold feet. Sleep very light. Cannot wait for dinner. Zinc for menorrhagia. Menses too early, too profuse. Passing of lumps of coagulated blood while walking. Restlessness of lower limbs with constant movement of feet. This general feature of zinc, constant movement of the feet. Ignatia for menorrhagia. Menorrhagia with sighing and sobbing, faint feeling at the pit of stomach, bad effect of suppressed grief, great despondent. Pit of stomach is this region. This is at the end of the sternum bone. The sternum bone is related to two fossa. This is suprasternal fossa and this is pit of stomach. Calcare phosphor menorrhagia. Menorrhagia menses every 2 weeks, black and clotted, before menses rumbling, gripping in bowels and leukorrhea, especially with rheumatic women. Phosphorus for menorrhagia. Menorrhagia in nursing women. Menses early, profuse, long lasting, with pain in small of back. Picture already shown. Palpitation, lower extremities cold. Bohista for menorrhagia. Menses too often, too profuse, flowing less during day when on her feet, worse at night when lying down. Between periods, flow of blood from every little exertions. Lidum pulp for menorrhagia. Profuse menorrhagia from polyps. Menses too early, too profuse. Patients lack vital heat. Very cold. Feel very cold always. Lack can for menorrhagia. Bright red blood. Stingy. Hot as fire. Coming in gases and clotting easily. That is blood coming in gases, clotting easily. Constant bearing down pain as if everything would come down along vulva. On the right hand side, I have shown a picture of endometrial polyp, one of the very common source of menorrhagia. With this, the video ends. Thanks for listening and viewing. Got any problem? Please write down in the comment section. I would certainly respond.